Hey, future respiratory therapists. Today we're going to be talking about cardiogenic shock. I am so excited to talk to you about this topic. Let's get into it. So, with cardiogenic shock, there's actually a lot of research that has been done. This is kind of unfortunate because the reason so much research has been done is because so many people have heart attacks every year. Um, but I want you to, when you think of cardiogenic, I want you to think of cardiac fails. So the heart fails to pump, which causes tissue death, and in turn, that causes severely low blood pressure and a lack of proper cardiac output. So cardiogenic, think cardiac death or cardiac fails. I just included this image because I thought it was kind of cool looking. I found it on the website in the research. So I just included that in here and just put the description and stuff of the coronary angiography image. So by now, you probably have caught on that there's kind of a bit of a pattern here. So anytime we're talking about decreased cardiac output, we're typically talking about severely low blood pressure. And with severely low blood pressure comes hypoperfusion or decreased tissue hypoxemia, which causes an increase in heart rate and tachypnea. And this also a lot of the time will cause shortness of breath, just kind of as a result of the increased work of breathing, which ultimately causes a decrease in lung compliance. So we see all of these things feed off of each other and affect one another and kind of get out of whack because of one another. So when it comes to cardiac function, a lot of these imaging studies are kind of urgent. So as we see here, the coronary angiography, hopefully I'm saying that right, is often very urgently ordered when it comes to an acute MI. Chest x-rays are always useful. Not as much in this situation, but they're still useful. And then CT often can, kind of evaluate the changes that have taken place. And then ultrasonography, interestingly enough, can kind of see that fluid management. So, yeah, they're all pretty vital when it comes to diagnosing and evaluating patients with cardiac function issues. So interestingly enough, unlike hypovolemic shock, in cardiogenic shock, hemodynamics are a little bit different. So as we see here, the PCP is going to be greater than 15 millimeters of mercury. And then a lot of our other values will be decreased. Obviously, our cardiac output is going to be decreased. And then also our cardiac index, which is really just half of our cardiac output. So in this situation, we want to make sure that we're using a Swan-Ganz to properly monitor these hemodynamics, and then also utilize the device properly so that we kind of know where the issue is coming from, where the issue lies. So this can definitely tell us a lot. It's very interesting. And then I just included some other information that I found, research that I found on the website, just to kind of show other ways that you can kind of monitor the hemodynamics for cardiogenic shock. So as you can see from this slide, the inotropic agents are really important to maintaining blood pressure and cardiac output and being initiated like right off the bat. And then we have vasopressors that are also very important, and norepinephrine that is commonly the first line of treatment for shock. And then there's some other ones on here as well that are indicated for cardiogenic shock. So just like with some of our other types of shock, cardiogenic shock will most likely present as a metabolic acidosis. So that is a decreased pH, decreased bicarb, and a slightly elevated CO2. In this situation, we'd really want to make sure that we are monitoring the patient's ABG values on a regular basis to try to help balance that blood gas. This would be a situation where we would definitely use the Swan GANs or in the same regard an art line that we could routinely and often test the ABG to see where we were at with the patient's values. So I probably sound like a broken record at this point, but for mechanical ventilation, the settings and the modes, I couldn't find a whole lot online in terms of what would be the best settings for cardiogenic shock, but I tried to use my best judgment here when it comes to VCAC plus. I feel like that is the best for managing a blood gas and maintaining hemodynamic stability. And then, you know, if not intubated, a patient that was hypercapnic, being able to have a BiPAP or a CPAP if necessary. So contrary to the other types of shock, positive pressure ventilation in this situation can actually be very effective if it is left ventricular. Where we start getting into problems is when it's right ventricular. That can actually disrupt the patient's normal circulatory system. So just want to be mindful of that. Basically, make sure that you are focusing on when you're using it and why and if it is appropriate. So for cardiogenic shock, we went over some of the key signs and symptoms when it comes to identifying cardiogenic shock, such as severely low blood pressure, increased heart rate, increased respiratory rate, decreased cardiac output. We also went over some of the hemodynamics, some key factors when it comes to choosing mechanical ventilation, and then also some imaging requests that are typically made when a patient presents with these symptoms. I just want to thank you all so much for taking the time to watch this video, and on the next page I do have my references if anyone is interested.